welcome to Beyond the Money podcast. I am so excited today to introduce Karen. I know you've been in the insurance industry for over 25 years and been specializing the last few years in Medicare. And I know it just kind of tied perfectly with our 360-degree retirement roadmap because health insurance, getting to age 65, that big milestone birthday, is an important part of any retirement plan.
Absolutely.
So making the best decision, getting someone to give you the recommendation for what insurance is going to be a good fit for you, but even more importantly, be able to help you should you be traveling and issues come up or any health issues that come along the way. So I can't wait to get into this with you.
Yeah, there's a lot that goes into Medicare, and people don't understand it sometimes. They think it's one size fits all, but it's not. Insurance is so personal because what's important to you may not be what's important to your husband. And certainly is not probably what's important to me. So it's important that the agent or whoever you're dealing with understands that. And they're just not trying to sell you a specific product.
Well, insurance is very complicated. I've been a licensed advisor for a long time as well. And, there's property and casualty insurance,
Yes.
There's health insurance, there's supplemental insurance for Medicare, which is a whole nother alphabet soup and trying to figure that out.
Yep.
But there's just so many things. But, when you're talking to someone about your life insurance, your life savings, your health issues, the medications that you're on, the doctors that you go to, all the specialists, that's a very vulnerable place to be in. And you want to have someone, that you can really trust and rely on. I know confidentiality is always important for any of those areas, but I love that you had kind of out of that big, broad industry of insurance, which is all about protection of some sort, but you've kind of honed in and are really specializing on Medicare.
I'm finding that through my own family that sometimes decisions were made that weren't in their best interest, and coverages are needed that weren't there, and they didn't understand that. And that could be a costly mistake. You just turn on the TV and every other commercial is for, especially now with open enrollment coming up, every other commercial is for a Medicare Advantage plan.
Right.
And what's the right plan for you? And it's complicated. It doesn't have to be complicated, but for the layperson it is. It's, what's important to me? Is it having that right network of doctors? Is it being able to get the give back, and so it lessens my premium every month? Is it, being able to travel and not have to worry about a network? What's important, and having that is, that conversation with a licensed insurance advisor that understands is important because, again, a wrong decision could be costly.
Mm-hmm.
So.
Well, it's different, right? When you're viewing that decade, which I think, we were born from one of the greatest generations, right? You've got the baby boomers have been living this, dealing with their health insurance. And if you've got parents or if you're in the sandwich generation, you've kind of experienced some of that hard-won wisdom. But it is very appealing for many that want to keep the cost as low as possible. I know you and I both came from the law enforcement family world, and we had really, really great coverage with our spouses, and those are really hard things to give up. So where does someone go? What is the best recommendation? So first of all, let's back up just a smidge. The open enrollment is coming up. What dates?
October 15th through December 7th.
Okay. And that is open enrollment. That is for someone who wants to change their existing plan, right?
Correct. If they're on a Medicaid Advantage plan or a prescription drug plan, maybe with a supplement, that's when you would make that change.
Okay. But anyone turning 65, that doesn't matter. It's not just open enrollment when you're going to have that ability. That's how many days
when you
before?
turn 65, you actually have a 7-month period. The 3 months prior to your 65th birthday, the month of your 65th birthday, then 3 months prior.
Okay.
So you have 7 months. I generally, when clients call me and say, when should I, when do we need to get together? 6 months before your 65th birthday is a great time to have that initial consultation so we can have a conversation and I can find out what's important to you. And then we can get a plan, give you the information for you to go on to socialsecurity.gov and, do the necessary paperwork. Then generally it's 3 months before we'll start honing in on what products are out there, what's the best fit for you and your budget and your lifestyle.
The 65th birthday is probably the most celebrated.
Yes.
60, 62. I mean, you've got the ability to claim Social Security at 62. As you get older, you get to full retirement age as defined by the Social Security system. But 65, most are really excited about that.
They're excited because they can get off of that group health insurance and or the individual health insurance through the marketplace and stop paying that huge premium. Mm-hmm. And for some people, it's a major change, and you'll know this too, in their budget.
Yes.
Because health insurance could be $1,000, $1,500 a month for two people, and that's a lot of money.
Yeah.
So to be able to, I call it, you get a raise, that's pretty awesome.
Oh, I know. I mean, we don't want to get older necessarily, but, for Scott and I, we stayed on with the Florida retirement system, their health insurance, really, really great plan.
Yeah.
$1,800 a month.
Yeah.
I mean, that's a lot of money. That's a lot to be paying for just health insurance, not anything extra. Yep. But wonderful coverage.
Yes.
And many that want to retire before age 65, you've also worked with many for bridging that gap between employer insurance and turning 65 from.
So that would be through the marketplace insurance. And we also have clients, that stay on after 65 working and keeping the employer insurance. And a question is, when do I start I'm going to retire now. I'm 70 or 71, getting ready to retire. When do I sign up for Medicare? Mm-hmm. And that's always a big question. So again, as soon as you know or you start to think about it, that's the time to call your agent, call me, and we have that conversation. Okay, so you've signed up. Obviously, when you're 65, you have to sign up for Part A. That's required. Mm-hmm. So that's set. But then you got to go back on. You got to sign up for Part B, and effective that date of your retirement. And then we start to look at the plans that are going to be best for you and your family. When you.
So two things. I mean, Part A, Part B, Part C, Part D,
Alphabet
Medigap.
soup. It's alphabet soup.
It is. So can you kind of go over the parts of Medicare to kind of give us a little bit of an education?
Sure. And it's really not as complicated as it seems. So your Part A is your hospitalization. Covers anything anytime you go into the hospital. Part B is your regular medical. You go to the doctor. Your well visit, your specialist, your imaging. You have to go for an MRI, CAT scan. That's your Part B. Part C is the Medicare Advantage. Part D is your prescription drug plan. And then you get into Part G, which is your Medicare supplements or the Medigap, and that's a G and an N. There's Part F, no longer available, which is a supplement, which is a great plan, no longer available for, in today's time.
For new.
But
if you had the F plan, you could keep
correct.
That, right?
And people that have F, you'll never want to give that up because it just covers everything. It's a great plan.
I've always heard that. So if you're old enough and been on Medicare or long enough, then you have that advantage.
Yeah.
So
and a lot of people, the initial thought to me when they call me is, I want to go on an Advantage plan because it doesn't cost any additional premium, and sometimes you can get that give back. But there's a difference between an Advantage plan to a Medigap or a supplement. And so if you don't mind being on within a network, which you operate within a network probably on your current health insurance, if you're comfortable with that and you're comfortable with paying co-pays and co-insurance and your deductibles, Advantage plans are great because there's no additional premium. And in many cases, you can get the give back, and that goes against your Part B. So that's lovely. But then there's limitations to that too. If you travel within the country, or if you're, snowbirds and you're, spend the summers up in Vermont or on the lake in Michigan, and something happens, that Advantage plan could be a huge problem because it only covers the emergency visit, and then any follow-up care is out of network or not covered.
So choosing to have Medicare, everybody should sign up for Medicare.
At age 65, Part A.
Part A.
Absolutely. Required.
And then Part B, you should sign up for the Part B when you're no longer on a group plan.
Correct.
And there are times where we've talked to some couples that they didn't, all they had was Part A. So that's taking a bit of a risk. And then you have penalties
Yeah.
from the Social Security.
Yeah, and it's odd that someone would not sign up for Part B when they signed up for Part A if they didn't have health insurance, except that, they didn't want to pay the Part B premium.
Right.
But that penalty is costly, Jackie. It's a 10% per year that you didn't have it. So that's, and again, you've seen it more than I probably have seen it, but it could be a huge mistake. Mm-hmm. And sometimes it's not their mistake. Sometimes it's they're guided incorrectly.
Right. So you go with Part A and Part B, mm-hmm. The prescription plan. So that is an optional.
So that's Part D. That's part of the alphabet soup. And again, if you go with an Advantage plan, most Advantage plans include Part D. There are some that don't. So mainly the veterans, if you're a veteran and you get your prescriptions through the VA, so some veterans will take just, an Advantage without the D. But generally, you would have the D built into the Advantage plan, which is great. But if you go on a medical supplement or the Medigap, you definitely want that D because that's going to be your prescriptions. And if you don't sign up for the D, you'll get penalized just like you will for the B.
Yeah.
And it's 1% per month.
Yeah.
So it's again, costly mistakes that certainly can be avoided.
And I know you have a process, an intake form,
Yep.
and it's just about asking great questions,
Yes.
right? That's how you really uncover what is a good recommendation and a good plan for someone.
And CMS has guidelines that we have to follow, very strict guidelines, our training, and it's crazy. I've been just doing classes and going places for trainings and taking tests and so it's really important you understand those guidelines, mm-hmm. and they monitor it. And there's a process that they tell you have to follow. And that's why one of the first things that we'll do is we'll sit down and we'll have our first meeting. And nothing will be written in that meeting. It'll totally be an intake. Tell me what's important to you. Tell me what you're looking to get. Tell me your lifestyle so that we can make this plan fit your lifestyle and your budget. Mm-hmm. And from there, I go back and then I look at the different carriers. And that's another thing. So I don't just write for one carrier. I write for multiple carriers so that we can find, because there's different prices mm-hmm. Mainly for your Medigap, but there's different Advantage plans that offer different coverages. And some will offer a dental and hearing and vision. Some won't. Some will give you a little more in the over-the-counter expenses. Different things, but I don't know that until we have that initial mm-hmm. conversation.
Mm-hmm. So if I give 3 clients, for example, and I kind of give you some scenarios, can we kind of walk through that and what you think might be a good solution for them? So let's say couple A, right? So Tom and Sue.
Yep.
They're one of them's just turning 65, one's already been 65. Let's say that they make $120,000 a year. Let's say that they have, $1 million, say, for retirement. Let's just keep the math very simple. So they don't have any pensions. They don't have major health issues.
So if they're not going to be doing a lot of traveling outside the area, the local area, budget's important because although $1 million sounds like a lot, it's still, they're going to live on that. Mm-hmm. Most likely, again, if they're comfortable within a network, staying within their network, which they're probably used to doing with their employer-based, coverage, probably an Advantage plan with prescription plan built in is ideal for them.
Okay.
It's going to suit their needs based on that, brief description. That would probably, and it's explaining to them, this is your network, and then within that network, every time you go to the doctor, this is your copay. Mm-hmm. If you have to have imaging, this is your coinsurance until you reach your deductible. If they're on high prescriptions, we have to explain how the prescription coverage works now because depending on what tier it is, there's different fees for that. So, And then once they hit their maximum out of pocket, then, it's 100% paid. But it's having that conversation.
So somebody who's going to be more local, not traveling
Yep.
outside of the state of Florida, who doesn't have a lot of medical insurance, may be a good option for them.
Advantage plans are wonderful plans, yes.
Okay. And now we've got couple B. So you have couple B, they've saved $1 million. We'll keep it the same amount saved for retirement. They don't have any pensions either. They're just got Social Security income, and they're relying on their investment income to supplement their income for their needs. But they love to travel. So just say they're both turning 65 as well. What would be a good solution for them? Retiring at the same time, needing insurance, a Medicare supplement, and knowing that they're going to be traveling internationally, not just in the United States.
So a supplement would be a great idea for them if it fits into their budget. And they range at 65, probably about $200. And they go up every year. It's just like everything. And then your prescription drug plan is additional. And that could range from $0 up to $120, depending on the prescriptions that they're on. So if they're traveling local or within the United States, it's set it and forget it. Something happens, they're in Wisconsin, they're out in Alaska, whatever it is, they've got that medical coverage that they need. If they go international, there's limited, and every plan is different, but usually and it's lifetime sometimes, so it's a max cap, like let's say $50,000 over your lifetime. So,
Okay.
But, it certainly is worth having. So I always recommend, obviously, if you're going to travel international, always to get that medical plan, travel insurance. This way you're covered. If something happens overseas, it pays to fly you home, with the medical transport and things like that. So very, very important coverage when you travel international to get that.
And a lot of people think, well, things are not ever going to happen to me. I'm healthy. I've never had any health issues. But how many times have we had the conversations with the spouse or with the client, and they had gone with I'm healthy. I don't need that extra protection, but it only takes once, right? It's like a parachute. So knowing, I think you said a key thing there, knowing what your maximum out of pocket is, either for that year, that calendar year, or for your lifetime. I think that is really, really key, and making sure that you're comfortable with that, because looking at the worst case scenario, I think, is always a great way to look at protecting your risk.
And you don't know, we all think everything is, it's not going to happen to me. But I've seen it happen to friends and clients. And when it affects them and they come to you, and now it's totally changing their life, because they have this huge medical debt now. And their retirement that they thought they were going to have is not going to happen, because it's now that money has been consumed by a hospital.
Yeah. Well, it's peace of mind,
Yeah,
really
peace
is the
of
big
mind
thing.
is
That's
huge.
what insurance is really for. Otherwise, no one would ever carry insurance,
Right.
homeowners or flood insurance or anything.
Yep.
I know car insurance, you're supposed to
Yeah.
have in the state of Florida. So I kind of like that they have some base requirements if you're driving.
It's nice to know you're protected, and it does give you that peace of mind. And, when I was in the property and casualty world, I would always suggest, certain higher limits. And they're like, why do I have to have that? Because you want that peace of mind. You want to know. God forbid something happens, it's not a problem. I've got that coverage.
Right.
And that's priceless.
Right.
Priceless.
So if we have couple C, so let's say it's another Tom and Sue. They're both just retiring at age 65. And let's say that Sue has had a family history of health issues. She's currently on some medications. She's got several specialists, a cardiologist, some cancer history in her family.
Yeah.
Hasn't had the genetic testing, but there may be some possible tracking there. And they're going to be doing some traveling, some mostly in the United States. What would be a good solution for them?
So again, I would suggest the Medigap, because you're going to pay your $257 deductible, and everything's going to be covered at 100%. It is such a set it and forget it. It's wonderful. And then you pay for the prescription drug plan. But let's take a different scenario. Sue and John. Sue has the medical issues and travels. John is a homebody and he's pretty healthy and he's okay with staying within a network. Sue can have the Medigap and John can have an Advantage plan.
So even if they're...
You don't have to have the same.
Okay.
And I know my husband and I are very different. So he may want one plan and I may want another plan. And that's okay. You know, it's so individualized. So, but definitely that Medigap, set it and forget it. You don't have to worry about, is Moffitt in that network? If I have to go to Gainesville, Johns Hopkins, are they in are they in my network? They are. You want to go to NYU for treatment? Go ahead. Yeah. It's covered under that Medigap. So I know there's a cost to it, but what a huge comfort and peace of mind.
And Medigap, that's the Medicare supplement. So a lot of people refer to that just as a supplemental insurance. Cost, I know that is a big decision maker. And thanks for going through that exercise with me. I just wanted to get some compartmentalizing there. But with the Medicare supplement, the average cost is what for an individual?
Depends on age. And I just ran 2 quotes. So I just did one for someone turning 65. And it was $197 a month. Okay. 71-year-old was $220 a month. Okay. So both of them, ironically, were both very healthy and took no meds or little meds, just tier 1 generic meds. So we were able to get them a very inexpensive prescription drug plan. And some prescription drug plans don't even cost anything. Right. So, those are great for the people like the 2 I just talked with that are on no prescriptions or just want tier 1 generics. That's covered, $0. So knowing the right product for your client and giving them the right product for your client. So we may not make commission on that $0, but at the end of the day, it's the right thing to do for that client. And understand, you can always change your plan. Something, during open enrollment to go to a Medicare Advantage plan if you're on a supplement. So finances change or you stop traveling as much because we get older. We're not going to travel as much, if health things happen. And you might want to, change to that Medicare Advantage plan. And that's fine. And you can do that during, annual enrollment.
So the key is to sign up before about 64 and a half, really start paying attention. So that's a key birthday, 64 and a half. Make sure that you're getting educated. Number 2 is to be honest with the agent and the advisor that you're working with. I mean, having a trusted professional team, I think that's some of the hardest won wisdom that I've seen clients make over the past 33 years is, just not paying attention and just checking it off the list, right? I mean,
big concern for me when I walk into these box stores and I see these kiosks up there, and some of them are wonderful people, but there's some people that they do it for the season and they're gone. And again, I've had clients that say, I've been, the number's disconnected and now I have an issue and I can't reach them. Can you help me? Of course I'll help you. I'm not your agent, so I can walk you through with the process of what you need. But so that's a big concern, the trusting, the knowing that you can come into our office and, we're going to be there. Right. And we're going to be able to help you. So big factor for me is, making sure you know who you're dealing with.
And I like that you bring that up, having the trusted professionals or the team that you're working with. And that's what we've tried to build at Campbell Company. 33 years, that's a long time. Yeah. I feel like we've grown up in business together for sure. So having someone in our office, that has really added a lot of value for me and the clients that I'm working with on the 360-degree retirement roadmap. I know one of the big pillars of financial planning in general is your insurance, your protection, your asset protection, and health insurance and long-term care is certainly a big part of that. So I'm so grateful to have a Medicare team and having you lead that in our office here at Campbell Company. And we have 3 locations. Yes. So we are here in Trinity and Pasco County. We've got an office, the flagship office in Hernando County at Spring Hill. And then we also have an Inverness office in Citrus County.
And I travel to all 3 of them. And I'm really excited to be a part of the team and to bring Medicare to Campbell Company. And when when we talked about it, and it just made so much sense to bring it in because it is part of that 360 retirement plan. And again, the peace of mind that we can give our clients to know that we're looking out the whole picture for them, and we're taking care of them, and it's important. It's part, they're part of the Campbell Company family, and you take care of your family.
Oh my gosh, yes, the ones that matter most to you for sure. And our mission, and I think you definitely embrace this, and you've always helped. You were my insurance advisor for so many years. You were on my personal advisory board. So I'm so grateful for everything that you've done for me and my business and my families through the years, and clients through the years as well. But our mission here at Campbell Company is to help others be the hero of their own financial story. And even something as simple as Medicare supplement or picking the right plan or the right plan for you in a different season of your life can be extremely important. And I think it's just kind of like the icing on the top. Right. So thank you so much for that.
My pleasure. I'm happy to do it and happy to be here.
Any other tips if somebody is coming up on 64 and a half, some key 1, 2, 3s action step? 3.
You definitely need to meet with your advisor to start that roadmap to your retirement. You need to definitely meet with a Medicare specialist so you understand what you're looking at, whether you're staying on your employer plan or not. You understand the process. And start enjoying your retirement. Get that plan for your first trip or whatever retirement is for you. Do it. Make the bucket list and start checking it off because life's too short not to.
It is. It goes by really fast. Like it or not, getting older is not for sissies, as my grandmother used to always say.
Yes.
And, you see a lot more the older you get. But, enjoy those big milestones. 65 is a great one.
Wonderful.
It's a great way to get your insurance costs, your health insurance kind of under control. And, making sure that you're making the best decisions. And, the good thing is you can always have it evaluated. We'll do a complimentary review to see what they're doing. Are they in a good plan? And I have seen it many times. You're like, hey, you've got the best plan for you. Stay with your plan. Stay with your agent if that's working for you. But then when somebody's retired or they're not working anymore, then, trying to be a fiduciary and help them make some really good decisions just for them.
Yeah. It's funny because when I meet with a client every year, we try to do reviews with all the clients for the Medicare. And that's the first question I say. How did it work for you this year? And sometimes it works. Sometimes it works better than others. Sometimes there were some hiccups. And that's a great, conversation to have to see, okay, well, let's make some changes then because we want it to work. But your health changes from year to year too.
Sure. Mm-hmm.
So we need to make changes to make sure that it's working for you the current year.
Yeah, great. Well, thank you as always, Karen, for your time and your wisdom and your expertise and for always doing the right things that I've seen with my clients and for always doing the right things with our clients here at Campbell Company and for me and my family personally. I appreciate you.
Thank you, Jackie. Appreciate it.
And if someone is looking for additional Medicare information, you're coming up at that 64 and a half birthday, that big milestone, give us a call. We'd love the opportunity to speak with you. You can ask for Karen, and the number is 352-683-7365. Or you can go online at mycampbellandco.com, and there's a box right there in the middle of the homepage, and just put in a comment that you're 64 and a half and looking for some help with your Medicare supplement insurance or Medicare assistance. And we'll be happy to talk with you and see how we can help. Thank you for joining us on Beyond the Money podcast.